Hi there, my name is Meg, and I'm going to talk to you about a medication called levothyroxine, which is going to be prescribed for you. You will take one pill every morning. This medication is used to help people who have a problem with their thyroid gland called hypothyroidism. These might sound like big words, but I will explain everything. I will explain how the medication works, possible side effects, and things that you might need to know about different age groups, like how it affects kids and older people. I will also make sure to explain things in a way that is easy to understand. And if you have any questions, just let me know. Your thyroid gland is a small gland in your neck that makes a particular hormone called thyroxine. This hormone is like a manager of your body's energy levels. It tells your body how much energy to use. Sometimes your thyroid does not make enough thyroxine. That is where levothyroxine comes in. It is a man-made version of thyroxine, which helps your body work better. Thyroxine is important because it helps your body do many things, like growing, staying active, and using energy from food. It even helps control your body's temperature and your heart rate. Taking levothyroxine does the same job as thyroxine does and helps to bring your hormone levels back to normal. When you take levothyroxine, your body absorbs it from your stomach and intestines and into your bloodstream, and it travels to your cells. Then it travels all around your body till it reaches your thyroid gland where it is needed. Thyroxine, which is also called T4, is turned into something else that's important called T3. Think of it as levothyroxine turning into a superhero. This T3 is the one that gets things moving in your body. T3 and T4 go inside your cells and talk to something called the cell nucleus. It is like they are giving instructions to the cell's control center. They help your body make new sugar when needed, use and store sugar in your muscles, and build new proteins. They even make your body work faster when it's just resting. When you take this medicine, or you take a medicine called levothyroxine, and it starts working inside your body, we call this the onset of action. If you take it by mouth, it takes about 3 to 5 days to start working, but you might need to take 4 to 6 weeks for the best results, or till you start feeling better. It's important to keep taking your medicine every morning on an empty stomach about 30 to 60 minutes prior to breakfast, even if you do not think it is working. This is so that your hormone levels will stay stable and you will start to feel better. Absorption is like how the body grabs onto the medicine or takes the medicine in after swallowing it. Sometimes your body only takes in about 40 to 80% of the levothyroxine, and when your stomach's empty, it can take 79 to 81%. That's why it's important to take this medication first thing in the morning and on an empty stomach. Things like age, certain foods, and other medicines can affect how well your body takes in medicine. You might want to avoid some foods because they can stop your body from absorbing the medicine well. These foods include grapefruit juice, soy formula for babies, soybean flour, cottonseed meal, walnuts, and other foods with lots of fiber. Some examples of high fiber foods are whole grains like whole wheat bread or brown rice, oats, beans, lentils, fruits with skin on it, or seeds, fruits with seeds like apples or some berries, some vegetables like broccoli and carrots. These foods are really healthy, but if you're taking levothyroxine, it's a good idea to have them at different times from your medicine, so that way you can get the best out of both of them. Metabolism is when your body changes the medicine to make it work better for you. Your liver helps a lot with this. It turns the medicine into the form called T3. And some of the medicine changes also in your kidneys. The medicine will go back and forth between your liver and intestines as well, which is a bit of a trip it takes. The time to peak means when the medicine reaches its highest level in your blood. For this medicine, it's about 2 to 4 hours after you take it. Half-life is how long it takes for half of the medicine to leave your body. If your thyroid's healthy, it takes about 6 to 7 days. Lastly, excretion is when your body gets rid of the medicine. Most of it comes out in your pee and about 20% in your poop. So, potential side effects. Most people do well with levothyroxine, but it can have some side effects just like any medicine. Sometimes, when you start taking levothyroxine, your body may react in different ways. Some reactions are serious, like being sensitive to the medicine or having problems with your heart rhythm, heart failure, high blood pressure, or chest pain. In younger patients, there might be some swelling in the brain, or in infants, the bones in the head may close too early. You'll want to go directly to the emergency room if or to the hospital. Call 911 if you develop any serious reactions like a swollen face, lips, tongue, throat, or develop chest pain or any trouble breathing. Um, you will also need to go to the emergency room if you feel weak, confused, too cold, or swollen. Other more common reactions are that your heart feels like it's beating too fast, you're wanting to eat more, you're feeling nervous, shaky, losing some weight, sweating, having an upset stomach, stomach cramps, trouble sleeping, feeling warm, changes in your periods, feeling sick or worried, getting a rash, or your muscles feel tight. You'll want to let me know if you have any of these. Special considerations for children and older adults. The dosages may be different for kids and older people because their bodies work a little differently. Kids' dose depends on age and weight. It is also important to check their blood work and hormone levels more frequently and their growth regularly to make sure that the medicine is working well. We also keep a close eye on kids' hearts during the first 2 weeks of using this medicine. And for older people like grandparents, this medicine works well, and we haven't found any special problems so far. As people get older, though, sometimes their hearts and blood vessels can have some issues related to their age, and their dosage may just need to be a little bit lower. If you're having trouble having babies because your thyroid isn't working well, this medicine can help, but remember, it is not used just for making babies. If you have diabetes, checking your blood sugar throughout the day is super important. If you think that you're pregnant while taking this medication, please make sure that you tell us right away. When you are pregnant, you might need a different amount of levothyroxine. That's why. If you're a woman who is not having periods anymore, it is possible that your bones could become weaker. This might cause, or this is called osteoporosis. It is like your bones become more fragile. Sometimes when you start taking levothyroxine, your hair may fall out a bit at first too. If you forget to take the medication, take it as soon as you remember it. But if it is almost time for your next dose, do not take the missed one. Just go back and take it like you usually do. Never take 2 doses at the same time. And please do not stop taking this medication suddenly without checking with me first. We will recheck your blood work in 6 weeks to see if your hormone levels have gotten better, and we will check to see how you're feeling. The blood work we measure is called thyroid stimulating hormone, or TSH, as well as a free T4. I will make changes to your levothyroxine dose if it appears that you need more or less, and we'll keep checking your thyroid hormone levels every 3 to 6 weeks to adjust the medicine until your hormone levels are where they should be. We'll want to make sure that you get the right amount to keep your thyroid balanced. Once your levels are good, we'll recheck your blood work every 4 to 6 months, and then once a year to make sure things stay on track. If your dosage changes, then we'll go back and check it a little bit more often as we did in the beginning. Do you have any questions? Thank you so much.